Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mechanism of action of alpha 2 agonists. Alpha 2 agonists mainly include clonidine and methyl dopa. So these alpha 2 agonists are like clonidine and methyl dopa are present. Among these, methyl dopa is the one which is most commonly used when compared to clonidine. So these mechanism of action is they will block these clonidine and methyl dopa or alpha 2 agonists will actually block the alpha 2 receptors when the alpha 2 receptors are actually a presynaptic receptors. Because they are presynaptic receptors, when alpha 2 receptors are blocked, this will reduce the release of norepinephrine. This will reduce the release of norepinephrine is reduced from the central neurons. So because of the reduced release of norepinephrine will result in bradycardia. It decreases the cardiac output, and peripheral vascular resistance may also increase. Especially this peripheral vascular resistance may be increased because of the alpha 2 stimulation in the blood vessels. So there are two things. One, these alpha 2 receptors are the presynaptic receptors which are present here in the presynapse. So when the alpha 2 receptors are blocked, this will result in decreased release of noradrenaline. Norepinephrine will not occur. So norepinephrine normally increases the cardiac output and causes tachycardia. So as a result, because of reduced release of norepinephrine, it results in bradycardia and decreases the cardiac output. Then in the beginning, because of the stimulation of these alpha 2 receptors, because of the stimulation of alpha 2 receptors in the blood vessels, this will result in increased peripheral vascular resistance may be seen. And sometimes even these alpha 2 receptors will also cause reduced renin release. So among the both, one important thing is clonidine. This clonidine will directly inhibit the alpha 2 channels. Okay, it will directly inhibit the alpha 2 receptors, whereas the methyl dopa, this methyl dopa will first have to get converted into methyl dopa is a prodrug. So this methyl dopa should get converted into alpha methyl norepinephrine, and this will inhibit the alpha 2 receptors, whereas clonidine directly inhibits the alpha 2 receptors. Then we also have newer drugs like moxonidine, and we also have rilmenidine. So moxonidine and rilmenidine are actually the newer congeners of clonidine. These mainly have longer plasma half life, and thus they are said to be selective for imidazolin receptors. They are mainly because they have longer half life, and they are mainly selective for imidazolin receptor rather than alpha receptor. Then rebound hypertension is much less frequent in these drugs.
thank you and thank you for watching.